Hi everyone, this is Michael, and this is for my Human Communication Informative Speech. So, this is the best I could do. So, I just realized after an hour of trying to do this that everything's going to be backwards no matter what I do. I've tried so many different ways. So, just bear with me. We're going to begin. So, I did my speech on CMT. When I'm finished with my speech, I want my audience to know what CMT is, what the symptoms are, and what life is like for those with it. People often wonder why my hands look the way they do or why I walk a little funny. So, the reason for both of these things is that I was born with CMT. CMT does not stand for Country Music Television, nor does it stand for Can't Meet Today. What CMT does stand for is Charcot-Marie Tooth Disease. Fun fact, CMT has nothing to do with sharks, teeth, or white women named Marie. Charcot-Marie Tooth Disease was named after the doctors who founded it, actually. Charcot-Marie Tooth Disease is a group of disorders in which motor and sensory peripheral nerves are affected, which results in muscle weakness, muscle atrophy, as well as sensory loss. So I want you to do something for me. Go grab it, if you have it, a pair or two of latex gloves, kitchen gloves, winter gloves, as many kind of gloves that you can spare. Pause the video and go ahead. So put the smallest set of gloves on first, okay? And then try to put another pair of gloves on top of that, and so on and so forth, okay? So once you do all that, if you have the gloves, I want you to try to get a pen and a paper and try to write your name, possibly your favorite color, or one or two sentences about what maybe you want your future to look like. Do you feel how difficult that is? Okay, what about trying to zipper or unzipper a jacket? What about trying to button up something? This level of difficulty is somewhat how it feels to be affected by CMT. So, Charcot-Marie Tooth Disease is an inherited genetic neuromuscular disease that causes mild to severe symptoms for which there is no cure. So, for myself, by the age of 3, my biological mother knew something was wrong. While I could walk, it seemed if I had 2 left feet. I would constantly trip and had trouble and had terrible balance. These symptoms led us to doctors who would diagnose me with muscular dystrophy and then later Charcot-Marie Tooth Disease. I have lived with this condition since I can remember. I've had multiple surgeries, been on so many medications, and have had so much occupational and physical therapy, and have been through so many doctors I couldn't even begin to count. So, firstly, I'd like you to understand what exactly is CMT. So, CMT is Charcot-Marie Tooth Disease, which is one of the most common inherited neurological disorders. Charcot-Marie Tooth Disease was named after the 3 doctors who first identified it in 1886. Dr. Jean Martin Charcot, Pierre Marie, and Howard Henry Tooth. CMT affects the peripheral nervous system. The peripheral nervous system lies outside of the brain and the spinal cord. Nerves, depending on their function, are known as sensory, motor, or mixed. Sensory nerves carry sensory impulses from the body to the central nervous system, whereas motor nerves carry impulses from the central nervous system to the muscles of the body. With CMT, these messages can become distorted. They get interrupted, so to speak. The nerves in those affected by CMT are not able to send electrical impulses properly due to abnormalities in the myelin sheath, which is actually an insulation that goes around the nerve. So, like you can see here, sensory nerve would tell that the flame is hot, and then the motor nerve is telling you to pull back your hand. There are 4 types of CMT and multiple subtypes, which typically determine the severity of the case. After hearing what CMT is, let's take a look at what symptoms are like for those with this disorder. The first signs of CMT are usually frequent tripping, balance problems, clumsiness, and the sensation of pins and needles in your hands and feet. I know you cannot read that. Often with CMT, there are structural issues with the bones in the feet, leading to extremely high arches and curled toes. The bones in the feet, due to the structural issues, are more susceptible to fractures and breaks. I broke, myself, bones in both of my feet over 13 times which eventually led to surgery. Another symptom is muscle weakness and muscle wasting, which is very common for those with CMT. Those with CMT often face difficulty with tasks involving hand dexterity, such as writing, using a button or a zipper, and so on. Another symptom is abnormal sensations, such as pins and needles in the hands and the feet, numbness in the hands and the feet, and something really weird, which is the inability to feel where one's limbs are in space, which means like you don't know where your arm is, but you know where your arm is. The inability to feel hot and cold, and oftentimes severe muscle and joint pain. Additional symptoms can include tremors, hip or knee problems, muscle spasms, chronic fatigue, breathing difficulties, problems swallowing, reduced reflexes, scoliosis, and even hearing loss. Now, while all those symptoms are physical, the psychological impact of having CMT can actually be quite devastating. The psychological impact can be seen as irritability, depression, anxiety, isolation, loss of pleasure, weight gain or loss. I feel like one of those commercials, and feelings of hopelessness, worthlessness, or guilt. Which brings us to what life is like for those with CMT. So, the journey starts with diagnosis. Diagnosis is made during a clinical evaluation where multiple tests are performed. As you can see in this picture, hopefully, I don't know, this is a normal foot, this is a foot that has CMT. So after they would see that, they would perform evaluations to measure the function of your muscles, testing of sensory responses, and they would also do nerve conduction studies. The best way to ascertain whether or not you have CMT is through genetic testing, which is done through blood work. After diagnosis, doctors typically inform their patients that there is no cure for CMT, and that the only thing to do is treat the symptoms and try to make your life try to make you as comfortable as possible. So that results in a treatment plan. Treatment plans are dependent on how severe the case is. For example, some people need forearm crutches, wheelchairs, or assistive breathing devices. For many cases, however, medication is prescribed to help treat the pain. They're also given physical and occupational therapy. They're given orthotic devices, which are called AFOs, which go on your feet to help give your feet more structure, so you're not tripping and falling that much. They also give walking assisted devices such as forearm crutches. They can give you wheelchairs and stuff like that. So that covers that. Lastly, to sum it up, we talked about how CMT is an inherited genetic neuromuscular condition, what the symptoms are, what life is like for those with CMT. So the next slide here I'm going to show you is, hopefully you can see that. So these are what forearm crutches look like, and these are what AFOs look like. Typically they're prescribed to, when you first get diagnosed, they're prescribed to children. I've had AFOs, I've had back braces and stuff like that, and it's all to help strengthen your feet as you're growing. I've been really blessed that I don't need forearm crutches, but sometime in the future, most likely I will need them. So I'll leave you with one final thing about CMT. Now that you know a little bit more about it, I just want to say don't take your body for granted. And thank you so much for your time.